On average, every day, 10 Bay Area patients undergo hernia surgery using a controversial medical device that we've discovered is fraught with problems. KTVU Health and Science editor John Fowler investigates surgical mesh. And we want to warn you, some of the images in tonight's special report may be difficult to watch.
32-year-old Yevgeny Yakimtsev says he finally has his life back. The Sacramento prison guard could not lift his kid's rocking horse or even bend over after routine hernia surgery left him in agony.
It started causing the pain, and the pain was progressing.
His surgeon had used a piece of plastic surgical mesh like this to repair torn muscle, standard in about 1 million U.S. hernia operations every year. But our investigation reveals big problems with mesh and with rules supposed to protect patients.
I'm willing to pay anything just to get rid of pain because I was depressed.
On painkillers, he was unable to work until one doctor diagnosed it. That doctor practices here in Las Vegas and is one of the most outspoken critics of surgical mesh. Yakimtsev says he was willing to gamble on another operation to get rid of the mesh, get rid of the pain. We've uncovered increasing evidence that this may be a bad bet.
It honestly ruins lives.
Surgeon Kevin Peterson agreed to help Yakimtsev. He's done about 5,000 hernia repairs without mesh. Dr. Peterson showed me something.
I keep a collection of mesh that I've removed.
Something most surgeons never see. Surgical mesh after years in the body.
Just handle it.
Oh, it's hard.
Yeah.
He says he's removed more than 100 of these twisted, shrunken shells of tacked-in mesh.
When the scar tissue builds up around it, it shrinks. And when it shrinks, it pulls on those tacks, causing horrible pain.
I reviewed recent studies showing the plastic itself can trigger immune reactions. And one estimating 28% of hernia patients with mesh suffer long-term chronic pain. That's 5 million Americans.
Well, I believe this is like a powder keg.
You have to remember that even if you have a 10 or 15 or 20% complication rate, that means that 4 out of 5 people are doing well with the intervention.
Dr. Hobart Harris, chief of surgery at UC San Francisco, uses mesh.
In many respects, it is a near ideal material as a prosthetic. This results in a much more durable, long-standing repair with a much lower risk of the hernia returning.
It's the only solution for a gigantic hernia such as Deborah Cooper's. Her intestines hung in a skin sac for 15 years. Dr. Harris operated last year using mesh.
I mean, you saw the picture. Look, it's flat. I mean, can you believe it? Truthfully, 14 months out now, I am not pain-free, but it's minor pain, and I would trade it in a second for what I had before.
Dr. Harris blames mesh problems on surgeons misusing it. Surgical mesh is in a regulatory gray area. The plastic is government approved, but without guidance on how to use it. Last summer, the FDA warned mesh complications in some procedures expose patients to unnecessary risk. It did not mention ordinary hernia repair.
I think it's actually a source of collective professional embarrassment that we have not done a better job in terms of studying these materials.
Okay. Yakimtsev says just days after surgery to remove his mesh,
Spending time with my family, happy, smiling, joking, you know, things that I couldn't do before.
he says now he only wishes he'd known about the risks beforehand. Health and Science editor John Fowler, KTVU, Channel 2 News.